In this video, I'm going to go through 3 stretches for neck pain related to some sort of disc issue. 2 of them you want to do, 1 of them you want to avoid. And the irony in all this video is that the one that you need to avoid is the one that's most frequently told to patients to do repeatedly. And hopefully by watching this video, you'll understand exactly why you're doing these and the benefits that can be had from them, rather than just blindly going and doing an exercise because you were told to. That's one of the things that's so important to us when patients come here, is that they understand why they're doing something, even in a simplistic manner, because that means they're more likely to do it and also not get confused with conflicting advice out there on the internet, because there is a lot, when you're watching this video on YouTube and there's tons of advice there's a lot of stuff that can conflict, and if at least you understand why you're doing what you're doing, you'll understand its relevance to you and why you shouldn't perhaps be doing other things. So without further ado, first exercise is the bad one. Okay, and this is classically a forward head stretch, or pulling the head forwards to the one side to stretch the muscles through here. Okay, in a lot of cases with a patient, the degree to which you have neck pain is going to be influenced by the degree to which your head goes forwards. And what happens is, as your head goes forwards, it increases the compressive loading on your spine, and that causes inflammation, etc. But it also puts more stress on these muscles. These muscles are held in a stretched position, they're off balance, they're trying to hold on for dear life. And what you go and do when you do this stretch forwards is you stretch them even more. You also compress the discs on the front of the spine here, which is most unwise, and create more problems for yourself. Now I'm going to try and explain exactly why you're told to do these exercises, because that's important. Inflammation affects this section in the spine here where the nerves come out, and that's the classic trapped nerve or the symptoms down the arm. And the reason you do that forward stretch is not so much for the muscles really. The benefit lies in the fact that it opens out these little holes where the nerves exit. So it creates a hole that's that big into a hole that's that big, which helps alleviate some of the pressure that's pressing on that nerve. However, the consequences of doing that puts more stress on the discs, which are most likely injured in the first place because your head goes too far forwards, and it also stretches these muscles that are already stretched beyond their normal capacity on a day in, day out basis. So it's not particularly helpful. And also, without the understanding of the stress and strain that's going on in your neck, you're going to create more problems. So please, please, please think about it before you do it and get a thorough explanation as to why that exercise is for you, because sometimes it may be necessary in the very, very short term, but the problem is people get given these exercises and they do them for the next 6 months and make the problem worse. So don't get caught out like that. Now, I'm going to show you the next 2 exercises that you do want to do, and you want to do them in this order. And the first one is going to be using a band. Now you can use a band or a strap of some sort, and what we're trying to do here is take pressure off the discs on the front of the neck, because we know you've got that forward head carriage, open out those disc spaces, alleviate the pressure on those structures that are causing the inflammation. We're working here on the cause rather than the consequence of your neck pain. Okay, so first and foremost, the action that's actually going to be happening is something like this, to reinstill that nice curve in your neck and take pressure off these discs on the front here. You do this nice and slow. Some people, when they do this, it's like they're going to pull the head off, so don't do that. Okay, put the band around the middle of your neck. Okay, hold it either side. You can make it a little bit looser like so, and you just gently pull forwards and look up. Pull forwards and look up. Pull forwards and look up. You're not going in an extreme manner. You're not flying your head back here. That's silly and you're just going to hurt yourself. So don't do that. You work within a small range of motion and gentle pumping. It's just forwards and back. Forwards and back. Make it rhythmical. And you can do about 15 repetitions of that, and then move on to exercise number 2. Number 2, we're going to get you lying down. A lot of people with neck pain, when they lie in the right position, it alleviates the pressure on the spine because gravity is taken out of the equation. But often they use too many pillows, so their head's propped up like so, and it puts more stretch and creates other issues. Instead of that, you're going to lie on your back with a little support under the neck here, so that it allows that natural arch to open out these spaces and build on the mobilization work you've just done with the towel or the band like so. And all you'll use is something, a rolled up towel about the size of this bottle. It's just a Voss bottle. They're not our sponsor, but it's about the right size for the demonstration here. And just place it in the same spot, lying over it. And your head should be looking away from your body. You should not be in this position on the floor, looking down. That would be a mistake and will make you worse. So when it's in the right spot, you've got a nice arch through the neck. It stretches out some of these muscles on the front, which are often ignored, and also, as I said, it opens out those disc spaces. And you do that for around about 2 to 5 minutes or so, no longer. And that, in combination with the band exercise or using a towel as a replacement, will help actually address the underlying cause of those issues with your neck pain. Now, of course, with any exercise, even the other ones, you should try them a couple of times for a day or two, or even 3 days, and if you're not getting any substantial relief, you really need to go and see someone. But at least that gives you an understanding of what we would sort of go through with a patient, and what often works is a much more common sense, logical approach to doing neck stretches, especially if you've got any sort of herniated or bulging discs in your neck. It's fantastic. Thanks for taking the time to watch this video. We hope you found it useful. If you've got any questions, then comment below and we'll be sure to answer those as helpfully as possible. And there's some interesting videos here and here for you to watch, so click those if you're interested. And don't forget to stay up to date with all the latest notifications and videos and uploads. Subscribe by clicking above. Thanks for watching.